Yeah, go ahead. تفضلي.
Okay. Hi, I'd like to welcome everyone to another lecture organized by Issam Ferris Institute, specifically the Research, Advocacy, and Policymaking program. This lecture is also co-organized with the Faculty of Health Sciences, and as you all know, is entitled HIV, AIDS, and Migration, Understanding Screening Policies Towards Expatriates in GCC Countries. Our speakers today are Ms. Saja Michael and Dr. Nasser Yassin. Saja Michael is a graduate student of public health with a focus on health management policy. And Dr. Yassin is an assistant professor in the health management department. And policy. Saja Michael conducted a research project on HIV policies towards immigrants in the UAE under the supervision of Dr. Yassin. And this lecture is an example looking at HIV policy in the GCC and what research played a role in formulating these policies. So with no further ado, I will welcome the speakers. They'll be presenting for 30 minutes and then there'll be a Q&A. And also I encourage everyone to fill out our feedback forms. Thank you.
Okay. I think we need to hold both, I guess, right?
Yeah, I'm helping with this.
I'll just hold this. This is for the camera. Actually, this is for the camera, and this is for the... But I'll give it to... you have... No, I have to give it back to Saja. I want to tell you, this is Saja's work and her colleagues, so the credit goes to them. My name appeared first because I'm an academic, so but I think I want to give all the credit to Saja, to Muhammad, and Layal. This was part of a course last spring on policy analysis or health policy making, decision making. And what we intended is to look at real policies and to do analysis of those policies. So Saja and her colleagues look at the HIV testing policies for expats in UAE. And this is actually bringing us to a new project. We want to expand this now to look at all the HIV testing policies in the GCC. And now we have colleagues coming from international organizations who are interested perhaps to look at these policies in the whole MENA region. So this is still work in progress that started with Saja and her colleagues to look at the policies in UAE. Saja will tell you more how they did the analysis, and then I'll come back in the end and do some Q&A. I have to take this.
Hi everyone, can you all hear me? Alright, thank you all for coming and being here. I expected much smaller crowd, so if I get a bit tense, please excuse me. So I'm going to be presenting to you two main things. This is the major outline. So I'm going to be presenting, the big bulk is going to be about Project 1, which is the paper I've already done with my colleagues, with Dr. Yassin. I'm going to be going into the methodology, policy analysis, going into details, the context and rationales behind the policy making, the policy instrument used, and also the gaps that were found in the policy. And then I will go into limitations of the study, which also is the linkage between why we chose to do another project and expand it. And I'm going to be talking mainly about the aims, objectives, significance, and methodology of the newly proposed project. It's still in the making, so I don't have data for this. It's still in the making. So I'm going to start with Project 1. So this is what has been done in the class with Dr. Yassin. So I'm going to introduce you to my colleagues because they're not actually here. This is Muhammad, and he's Muhammad Abdul Aziz. He's from Sudan, and he helped me on working on the paper. This is Muhammad Hassan, and he's from Egypt. They're both not here, so that's why they're over there. And there's Layali, but Layal has today work at AUBMC, so she couldn't make it for the presentation. And then there's me. I didn't have a picture of me. So before we go in the details, I just want to present to you what is the current policy right now in UAE, so that we have a better understanding. Keep this in mind throughout the presentation, please. So for foreigners who are seeking residency visa or the renewal of one, HIV/AIDS testing is mandatory for them. And if they were found, they're mandatory, but after they get into the country. And then if they were found to be positive, they are immediately detained, deported, and they will not be able to get the residency visa. So the methodology of our analysis, basically we did a literature review of so many reports from UN mainly, UN GASS, UNAIDS, UNDP. We also did the reports from the Ministry of Health in UAE, in addition to reviewed academic articles, but there weren't so many of them. So we used this information in order to do an analysis of the policy itself. The criteria of the analysis looks like this. So I will be presenting mainly today the first three parts. I will start by discussing the background of the policy, in which I will be talking about the cultural context in the UAE, the problem that has initiated the formulation of the policy, and the rationales for the policy based on the UAE government. Then I will be going into examining the current policy, in which I will be looking at the tools, policy tools and instruments. I will talk about the characteristic of the policy and look into stakeholder analysis. And third, I will be going into the gaps of the policy, in which I will be talking about its social impact and its global impact. So this is going to be the main bulk of the presentation. We propose alternative policy for Dr. Yassin in the class because we needed it for grades. But I'm not going to be showing you this because this is technically the part of the second project. We're going to be talking to decision makers and trying to formulate alternative policies that are more realistic than theoretical ones based on our literature review. So I'm starting with the background. First, the context, a background for you to understand the culture of the UAE. The culture of UAE, it's very religious, very conservative, and practices that might are called high-risk practices that might increase the incidence of HIV are very minimalized, and they're very stigmatized. So as a result, the UAE recently, like in general, used to have a very low incidence, and it was even the lowest affected by the epidemic. In 2009, only 49 positive cases were reported. So this is the cultural context. As for the legislative context, this is going to come back later on when I'm discussing the characteristics of the policy. But in general, I want you to know that there are 7 emirates there, and usually there's a federal national council. It usually proposes the laws, and it's universally implemented within the 7 different emirates. All the emirates follow the federal law. They have their own internal law, but they must follow the federal law. Okay.
The federal law is the minimum. They can be stricter than the federal law as an emirate.
Sorry, I didn't understand. So the highest?
Yeah, is the federal law a minimum for them, and they can be stricter than the federal, or that's
exactly. They have to follow the federal, and then they can make their own policies. But
even stricter.
They can be stricter. Yeah, they must be stricter. Yeah. It's like the states. In the United States, national law, they have to follow it, and then each state can make their own policies, but they have to follow the national law. Yeah. So the problem, I just said that the HIV was not an issue. So what has initiated the problem and resulted in the need of formulating a new policy to restrict HIV, to restrict people with HIV, who are HIV positive? So basically there were two main rationales, saying that it became a touristic spot and oil. So because of this, the discovery of oil, and because it became a touristic spot, so many people, expatriates seeking work, had traveled and migrated within the UAE in order for better opportunities. This has introduced new habits and cultural beliefs brought in by the foreigners, and which has resulted in an increase in the number of HIV positives. It was mainly within the expatriates. So that's why I think that policy was mainly targeted towards expatriates. Such behaviors included IUDs, men sleeping with men, or prostitution, or sex work. So this is the problem that has initiated the formulation of the policy. The two rationales by the government are these. One is to compliance with the MDGs for combating HIV/AIDS, and they have promised in the to achieve the MDGs, in order to reduce, they have to reduce the incidence rates of HIV. But the second one, which is more interesting, is that they fear that they will form HIV resistance, because if they have initiated the treatment within their country, and then the expats had to leave UAE and go back to their countries. If the country is a poor country, then they probably do not provide HIV services and medication. So this might cause HIV resistance. Okay, so now we're going to be moving on and looking at the current policy, looking at the tools and characteristics of the policy. The policy it was turned into a law, which is characterized to be very rigid and coercive. There's a minimal room for playing around with it. It was universally implemented within all the 7 Emirates. It was a national law. And it was implemented within the top to bottom. There was no stakeholder influence within, like they were not involved in the policy making process. But the most interesting characteristic is that it was not based on evidence. Because according to evidence, scientific evidence, in order to limit HIV positive or reduce incidence and prevalences, you have to control risky behaviors. So the key was the control of risky behaviors and not travel. According to colloquial evidence, they tell you, okay, so we have high HIV cases within our country. In order to reduce this amount, we just stop accepting people who are HIV positive, and therefore we will be reducing the amount of HIV positive individuals within the country. But this has been proven not to actually work. What really works is you have to raise awareness about risky behaviors and try to control or limit these risky behaviors that might lead to the spread of HIV/AIDS. So I'm going to be quoting a report from UNAIDS in 2004. It said, HIV is not transmitted casually, but through specific behaviors. HIV positive and HIV negative people, whether nationals or non-nationals, can prevent transmission by practicing safer behaviors. Thus, traveling and migration by positive people in itself does not entail a risk to public health. As for stakeholder analysis, this was a bit of a challenge. This is a proposed structure because a lot of the information was actually missing from the literature review. So we could find reports that would tell us one information and then another report would say something else, and some information wasn't even available in publications. So in general, this was the structure. You had the Board of Governors. It's on the national level, the highest level of decision making. So they would propose a law and that has to be implemented within the 7 Emirates. As for Ministry of Interior was mainly responsible for the deportation of HIV positive. Whenever you were found HIV positive, they would automatically detain you and then they will make sure you are deported without providing you with any medication that has to do with HIV treatment. Ministry of Foreign Affairs, it was responsible for visa issuing. So technically, if you're HIV positive, you're not going to be getting a visa, or your visa will not be renewed. NGOs, all the information we could get about NGOs is that recently, like up to recently, the number of NGOs have been very few in UAE, and they haven't had a lot of influence in the HIV policy making or decisions or provision of services. Ministry of Health, technically, it was supposed to be testing for HIV. We had conflicting views about this, but I think it was the one responsible for ensuring HIV testing. Private sector, it was mentioned that it had low influence. However, it wasn't specified what kind of influence it was. Ministry of Labor, we expected to have an influence since many of the people asking for residency or renewal of resident visas are actually workers, but we couldn't find any information about this. As for international organizations like WHO or international labor organizations, we also expect them to influence, but we did not find any information. But this is actually critical. It's really interesting now because they've been talking about renewing or reforming the existing policy. And one of the articles I've been reading is saying that one of the main reasons they've been thinking about changing the policy and liberalizing it a little bit more is because of international pressures. So in the next project, we were hoping to dig a bit deeper and try to talk to people about and see if it was due to international pressures, it was based on scientific evidence, and I will go through that later. So the gaps in the policy, which is the most interesting part. So we have inequality. So inequality because in the testing, so technically only expatriates are asked to be tested for HIV positive, and nationals are not tested at all. Even if they travel outside, they have risky behaviors and come back, these people are not detected. They're not asked to be tested, and technically you're not detecting HIV in...
expatriates who are high pay, white collar...
We had the same question previously. We did not have information in literature, like no one was transparent enough to discuss this issue. So we were hoping to fill that, maybe if we can actually talk to individual stakeholders, key stakeholders or decision makers, if they will be willing to answer such questions, but it's not published in literature. I've watched some movies on CNN.
Well, professors who are recruited by universities there, they have to go test.
Yeah, but some people, they can get, it's waived for them. I've read, and there was a movie talking about HIV in UAE on Al Jazeera, it was a documentary on Al Jazeera. It said that they've been waived for some people, but it didn't go into detail. So like, I don't have actual information about it. So maybe we can dig deeper by talking to decision makers who can maybe, if they're willing. I doubt it, but we'll see. So as for expatriates, this inequality in testing have led to fear of testing, because they know if they're HIV positive, they're going to be deported. So they have a whole year of being tested, even if they engage in risky behaviors and they expect they doubt they might have contracted HIV, they would not get tested because they're afraid they're going to be deported before time. This might lead to the increased chance of HIV spread internally within UAE, which actually defeats the whole purpose of the policy in the first place. Another gap was in psychological damage. The social damage or psychological damage is resultant from discrimination based on HIV status. So technically, for HIV positive, you're going to be deported or you're not going to find a job. Another problem is the lack of counseling or proper dealings. So the UN have proposed a certain criteria of good dealing with the HIV positive people, especially for expatriates. But like, none of this is actually implemented in UAE. Once you know you're HIV positive, you're not provided with VCT counseling, you're not provided with any psychological help, you're immediately detained and deported, which is psychologically damaging. And the burdens of HIV diagnosis on the person themselves or economically on the family. So all of these issues will lead to psychological damage that can affect the individual themselves or the family of the individual. But the most striking is the global burdens. So we have two main global burdens. It's the economic burden, and the public health burden. Our concern is with the public health burden, which I will be talking to more into details. But technically what happens is that you have isolation and then deportation, and then you're not provided with medical treatment. Both of which will affect the exporting country, technically, I will call it exporting country of human resources, economically, because many of these individuals who are working in UAE are usually sending back money to their home country. So by cutting this chain off, you're economically damaging the exporting country. But most importantly is for us was the global health impact, because technically the policy is saying it's reducing HIV positive cases within UAE. It might be reducing it, but if you really look at it, every individual who's HIV positive, who's an expatriate HIV positive and is automatically deported, then they will have to go back to their country. Probably it's going to be a poorer country with no provision of services, with no medical treatment, which means that even though this policy is positively controlling or containing the HIV epidemic internally, but it's negatively impacting the global health of specifically in poorer countries. So I'm going to be quoting Mozienski. Sorry. Public health is not local but global. So when we're thinking of public health, we should be looking at the macro scale. So helping only in reducing HIV in one country, I don't know how this is cost effective or good for the global health in general. So general limitations of the study. We could not get a clear understanding of the policy making or policy implementation due to lack of published data about it or mixed information. This was for the class actually. We only proposed one alternative policy for the current policy. We did not provide different alternatives, and through taking classes in policy making, we've learned that usually a good policymaker or a good researcher, even if they want to provide information, they should provide alternatives, not just one, not the optimal one, but alternatives. And then the country or the people in decision-making positions, they can take the different alternatives and try to tailor them into their own context or situation. So these were the limitations of our studies, which have inspired us to look deeper and to turn into Project 2, which is still in the making. So we aim in this project technically to understand HIV/AIDS screening policies towards expatriates in GCC countries. We have picked 4 GCC countries that are Kuwait, Oman, Saudi Arabia, and United Arab Emirates. Through this study, we're hoping to understand the rationales behind the formulation of their current policies. And we want to try, in second, we want to understand the process of policy making, formulation and the implementation of the policy, including looking at the different stakeholders involved in the process. And lastly, we want to assess the perceived impact of these policies on the global public health, rather than just in country contexts. So significance of the study, hopefully, since there's little research study already been published about it, understanding the current processes will help us understand or identify any gaps in the processes, and this will hopefully help us produce policy briefs or any other types of knowledge that can help decision makers in improving the current the processes they're doing, or in improving the strategies of implementation within the country. Methodology, technically, we're hoping to do a content analysis in addition to interviews with key stakeholders, but we're still at the first stages of the research. We're still looking for funding, and we're still looking to network with some decision makers, because we've been told it might be a bit challenging to actually get access to the key stakeholders or people in high positions who are decision makers, and try to talk to them in these countries. So this is technically our study, our proposed study. We're still in the early stages, but if you stay tuned, maybe next year you'll see some findings. Thank you.
I can ask for some questions. Just to say, I mean, the idea came really in the course, and we're trying now to expand it. So there are still many gaps in our proposal and in the proposal. But the most important thing is we try to really look at the policy process, the policy making process, and the role of different actors in implementing this policy. And the second argument we want to look at how we can move from the framework, from the contour of the nation state when we do health policy, to argue that health is actually a global phenomenon, it's a global issue. We cannot just protect our nation state. The concept of the nation state, we want to argue, is rendered ineffective when we deal with health issues such as HIV/AIDS. So these are still our, we're still doing these, we're still working on them. So we would really look for some comments, some suggestions here. And we thought in the UN AIDS Day would be an opportunity for us to present this work. Yes.
I have a question and a comment. My first question is, at the beginning you mentioned that HIV has increased in the UAE, but mainly among expatriates. But I don't know if you can tell me how, I mean, what type of data shows that HIV is increasing more among expatriates than among the minority who are citizens? And I have just a comment about it would help a lot looking at immigration policies, not only HIV policy, HIV screening policies, but immigration policies in the Gulf and in other countries in the region will illuminate a lot why, you know, if an immigrant is HIV positive, then they need to be sent back.
So can you repeat?
The immigration policies in the Gulf countries are the labor and immigration policies are about bringing people to work at the lowest cost and not to incur any like financial responsibility on the host countries. So people will go to the Gulf countries, they work for 20, 30 years, they provide the labor, and then when they get old and they need healthcare, they have to go back to their countries. And they didn't contribute. They were not productive in their own countries. So these policies are very important to understanding HIV screening policies and other policies among expatriates. But if you can just tell me a little bit, how are they saying that HIV is increasing among expatriates more than among the citizens?
The resource that I got the information from was not the actual study. It was a country profile report by UN in collaboration with the Ministry of Health in UAE, and it mentioned that. I can forward you the report, but it's not the actual study.
Do they show data?
Yeah. Yeah, that's very minimum, just the total number at the end for expatriates versus
the total, because the UAE is 85% non-citizens, so
yeah,
the total number will be higher.
Sure. I don't know if they show percentages, but I will forward, if you're interested, I can forward you. But I don't believe it had percentages for another reason. And thanks for the class.
Very good work, Saja. Since you have the most information right now on the project that you've completed, I want to focus on framing the arguments. I'm thinking now of two main arguments that you brought up in your discussions. The first one is the impact on global public health, and the second is issues of inequities. And I would argue for expanding the framework of how you frame the problems that these policies are, in case you're thinking about writing something, or even if you're this going to be just the introductory paragraph to your thought. And if I don't see Omar, but if Omar was here, he would talk about the violence of this policy. And there's an inherent amount of tremendous violence in this policy. So this is one way of framing the finding that you have found. The second is hypocrisy. I mean, these policies, everybody's tested, white collar and blue collar, but the implications are different for white collars and blue collars. The implications are equally different for those coming from countries, higher income countries, Western countries, than they are from Arab countries, than they are from other countries. So this is a policy in which different actors have been playing to. So therefore, your stakeholder analysis does not consider the complicit participation of a lot of other stakeholders and actors, whatever you want to call them. So I would argue for the need to expand your stakeholder analysis beyond the national, because you are thinking beyond the national state. So in a sense, your stakeholder analysis does not do justice to your broader conceptual framework of the problem at hand.
Do you have a specific example of additional stakeholders or actors you're thinking of?
Well, the exporting countries and the different levels of the exporting countries. They're not included in your stakeholder analysis. They're obviously or at least I don't know if I saw it. Maybe I missed it. So that is a major stakeholder, and these sending countries are different types. And then another stakeholder is sub-international, so to speak, is the differentials of white collar, blue collar, blah, blah, blah. Perhaps also the issue of gender, all of that. I mean, there's a lot to expand on. I'm just arguing for the need to expand the framework of both the finding as well as the analysis.
Thanks.
Hi, thanks a lot for this interesting lecture. I actually do agree with the previous comment that it would be interesting to also expand on different to the more individual level. I don't know if this is part of your conceptual framework, but also maybe interview the workers about their experiences in these testings and what are the implications and whether they are even informed and that they're being tested and do they the informed consent and all the ethical implications of this as well. I mean, I don't know if this is beyond your study, but I mean, since we're talking about HIV/AIDS, it's basically it's a disease that affects people. So, I mean, policy making and all that stuff is very interesting, but essentially it's people's experiences that are important as well. So So just a little comment. And a question, has a similar study been done in Lebanon, or would there be something like an idea to do that in Lebanon as well?
To be honest, I haven't looked at review produced for Lebanon because I was mainly looking at UAE.
They don't require this.
They don't just
Except for the university.
No, everyone is. I have
Oh, really? I was. I'm American, so
I think for the Ministry of Labor.
Oh, and I'm a student. But usually you have to check for work permit. Okay. Because TB has to be checked, I think, even for students. Because usually TB and HIV, they're usually always argued together.
You get this information here as well, like the people to get a work permit. But I'm wondering if there's a study done, something like similar to this done in Lebanon.
Okay. To be honest, I don't have information, but I feel like I can look it up.
Thank you very much for an interesting study. I was wondering who had requested to carry out such a study. Was it something that you have started or you thought of as a team, or probably there was a request to carry out such a study from a third party? That's my first question. The second one is rather a comment. I agree that the Ministry of Labor is very much a stakeholder in all this, and it's very much a labor policy that needs to be looked at as well, and how workers and expatriates are being treated in UAE. Now, the other issue is, I don't know if I missed it, you might have mentioned it, I missed it in the stakeholder analysis, because you do mention the risky behavior, and it's a very important thing. In the midst of and you did mention also that it's a very conservative society. In the midst of this conservative society, don't you think that the Ministry of Culture or religion, or because probably the first thing they would think of is abstinence rather than prevention and really avoiding risky behaviors and etc. So that would be also part of. I'm only mentioning that because you asked for comments. So we want to probably tackle all angles.
Yeah, thank you. To answer the first question, it was it was a group choice. One of our colleagues, Muhammad Abdul Aziz from Sudan, has been actually working with UNAIDS before he came here. So he have had already experience about HIV, AIDS policies and working on awareness campaigns in different contexts. So the project was decided by Dr. Nasser, but we picked our own policy.
Not the topic.
No, not the topic, definitely. We picked our topic, and we thought that we were all interested in HIV, but Muhammad had the greatest influence in helping us pick HIV. And the comment, I understand the comment. To be honest, I was thinking more of the NGO role in order to be providing this awareness versus to bring in, to reduce the stigma of HIV first and try to provide prevention techniques or raise awareness of prevention techniques rather than abstinence. I wasn't thinking of maybe religious leaders or Ministry of Culture, but I think it's interesting. Maybe you can add it and look for data if it's available. Thanks. Yes.
Thank you for this presentation. I think it's an eye-opener for everybody, and it paves the way for the work that others are doing in the region regarding, on a broader level, policies related to travel restrictions for HIV positive people. I think you've only tackled today part of the migrants and related to UAE, but I think it would be important now that you're carrying on the project on a broader scale to see if you can expand it to travel restrictions policies related to HIV positive people. I think that's a subject now that's really interesting for many people, including the UN family, but also people in the civil society and in the NGOs. So congratulations, and I hope that you take it forward. I just have a few comments and observations. I think what you mentioned at the beginning is a little bit, I think I found it interesting that you mentioned that the underlying policies relies mainly on two issues. which is one that they want to meet the MDGs, which is related to combating HIV/AIDS, which is something that we all encourage. But on the other hand, they just hide behind the treatment argument, which is if they start a treatment in the UAE, then they cannot take it elsewhere, which I think is a little bit hypocrite that these two arguments do not go line in line. And I think it's important that you dig a little bit further to see what are the underlying policies in this respect. The other thing that you mentioned in your stakeholder analysis, I think I agree with my colleague that you need to take it to religious leaders as well, because the UNDP, UNAIDS, and others have done tremendous work in the region relating to the role of religious leaders in combating stigma and discrimination against HIV-positive people. And the UNDP mainly has done some work in the UAE. Also, when you mentioned the NGOs or the private sector, I think there are some, not NGOs, but there are some groups within the society there that have done some important work related to raising awareness and related to prevention. Maybe the Dubai police have done some work on IDUs and on sex work in the UAE. So it would be important if you want to review further these studies to talk to, if you can, to some people in the Dubai police who are responsible for these activities. If you want to take it further as well in your next project and discuss the GCC in general, I would recommend that even Yemen is not part of the GCC officially, but geographically they are part of the Arab Peninsula, and there is a relatively higher incidence in Yemen related to HIV positive. But on the other hand, Yemen has been one of the first countries in the region to pass a law in the parliament to support support the rights of people living with HIV/AIDS. So I think that's important to look at in your next project and to see, because Yemen is geographically related to Oman, geographically related to Saudi Arabia, and there's a lot of cross-boundary movement within those borders. So we will have a chance to discuss maybe after the seminar how UNAIDS will support your work, but congratulations.
Perfect, thank you so much.
Good work and good presentation. Can you go back to the, I don't know whether it's the second or first slide, where we talk about foreigners?
The policy itself?
No, before the policy. Yeah, continue. Because now, yes, this one or the one after, I will continue until I reach a place where we talk about foreigners breaking their habits and changing the place.
This one.
Yeah, that you're talking here, and I think this concerns me. I don't. This is your statement, or
no? I knew
who wrote that?
It was
because you're talking here about expatriates changing the culture and bringing new habits, and where actually it is the other way around. It's the country itself and the global changes and the national changes there. What's happening in Dubai and what's happening in Abu Dhabi. Actually, it's changing the habits and the cultural beliefs of the people who are coming in. I think when we were in Nain in that conference, like more than a year ago, and actually that sort of statement was mentioned by a medical doctor who works with one of these oil companies, and he was talking about the impact of the foreigners on the health of the nationals. And when he presented data, the whole data actually he presented was showing that the prevalence of obesity, diabetes, hypertension has increased actually among the expatriates as compared to the people in the origin, in the country of origin. So he actually was blaming them for the increase of everything, but when he compared them in his presentation, he compared them to Indians and to Sri Lankans and others in their own countries, it showed clearly that it's the country that's impacting them.
Yeah.
So I think that's an important context. And the fact that they're not contaminating the UAE society as much as I think a UAE policies, economic policies, are, if we want to use the term, contaminating their own people and the expatriates. I think the context should be a little bit. This should be challenged.
This is not my statement. I should have maybe quoted it. Yeah, I've quoted it from my UN report.
Yeah.
But
it's dangerous.
I agree with you. I knew this because I was working.
Thank you, guys.
Thank you for the presentation. I just have a comment and then two quick questions. The first one is that I think sometimes we forget that people who are HIV positive are not always hold the infection or the disease because of their risky behavior. Sometimes women and children are victims of this disease, and they get framed, and they because people are not aware that sometimes they contract it. So I just want, or even males, but also mostly women and children. My other question was, you mentioned that this policy was not based on evidence, and so I was interested in knowing, why do you think so? Conducting this study, you must have learned a little bit about the culture and the policy-making processes in that country. So why do you think evidence did not play a role in informing policymakers in this context? And my second question is, what about migrant workers who contract the disease during their stay there? So they come in, they're tested, they're not positive, they're granted a visa and they work. But what if they contract the disease or the infection during their stay? Is there a procedure where they get tested annually or something like that? Thank you.
I will go with the second question because it's a bit easier to answer. Yeah, it's routinely, you're routinely tested every year. In order to renew your visa, you have to test every year. So if you have tested positive and then you have like a whole year of not getting tested, and then you're going to be retested. So they'll detect you on an annual basis usually. And if you're positive, detained and then deported. The first question was based on how did we find out that it wasn't evidence-based, or how did we came to the conclusion?
And why do you think so? Why is it a situation of policymaking?
So the exact process, policy-making process, was not clear at all. This was one of the main reasons we were thinking of carrying on with the second project, in order to talk to people who are actually in the policy formulation process, in order to understand the details. But if you look at the rationale, which he mentioned was a bit hypocritical about the resistance for HIV positive. They're afraid of inducing HIV resistance. And then if you look at the UN recommendations and, for example, WHO, if you look at the international bodies, one of the quotes I said was that it's not about restriction of travel, it's more about risky behaviors. And if they took that into consideration, I think their approach to their approach to HIV and the way they would have formulated their policy would have been a bit different. Because if you look, they're not promoting awareness about HIV locally. There's a little work on it, but not like very impressive work. And the main target of the policy is restriction of travel. So if you take that into consideration, I think, I don't know, we concluded that it was rather based on maybe their stigma or fear of HIV rather than actually understanding the scientific evidence that has been already provided by other countries and other international bodies that they can use and take into consideration. Is that fair enough? Anyone else?
Yeah, yes, I want to go back to your argumentation. You said that working in risky behavior is better than just controlling the exposure. From the previous experience in a country like Sudan, I would say that it's just maybe it's not true, but I think now the policy maker and United Emirates at the level of denial, they are denying that there is HIV. That's why they are moving toward this type of policy. I remember in Sudan when they are trying to deploy the UN mission, the government of Sudan requested that every soldier or everyone in the mission should be tested, especially for the military people, should be tested against HIV. And for example, condom promotion, awareness in HIV was a little bit restricted when we started. Then with working with religious leaders and working with other stakeholders within the Ministry of Health, they realize that when we are talking about condom promotion, we are not promoting prostitution, because they think that whenever you talk in such countries about condom promotion, you are promoting prostitution. You are making condom available for the people so as to go and have sex. Yeah, let me talk right a little bit. So you have to take this into consideration and go in data for another countries and have some information, and especially I would advise like UNDP, they have a project which is Global HIV Global Fund. They provide funds for certain countries. Sudan is one of those countries, and they are working with the population most at risk, like the sex workers, men having sex with men, and they introduce new ways of advocacy in this area. So if you went through these projects, through these documents, at least you will have some sort of how the the stakeholder thinking. It will be a little bit easier, then you can find a way to.
Thank you. We did a little bit of this. I didn't present it because I'll take Sudan as an example. Maybe look more into it. Another example.
Yeah. Well, I mean, another way to sort of underline the importance of risk behavior is also to look at like the numbers of, for example, the people that, like our colleague was saying, that contract HIV in their country of destination, and then when they go back to their country of origin, like for example, there was a UNDP study on Bangladeshi women, Bangladeshi domestic workers in Lebanon, Jordan, and Kuwait, I think. And so they looked at the numbers, like they looked at the HIV numbers in Bangladesh, and I think about 60% or something, I don't remember the exact numbers. But the point is that a high number of, or pretty much all numbers of infections in Bangladesh are exogenous, so they are due to HIV infections contracted outside. So then, and then you compare those numbers to, basically the people that are coming into, or from Bangladesh coming into the GCC countries. They test negative, they're okay, they get their work permits, but then when they go back, I think they have to be tested again when they go back to Bangladesh. And when they go back, then they test positive, meaning that there has been a contraction in between. So, which means that there was risky behavior in the country of destination. So, like, you can play with those numbers to find out, like, to really understand, yeah, the risky behavior really is more important than just restricting travel.
Yeah, it's a good idea, but I don't know if we're going to find enough information on data.
It's very hard, yeah.
This was one of our main problems, even writing up this report. But I mean, I'll take that into consideration. Thanks.
Sorry.
Thanks for the just a short recommendation, and as a following up to Samuel's comment about framing the question. If you're also one of your ultimate goals is to change policy, just to take that into consideration when you're framing your question, especially that you want the policymakers to buy in and to have ownership of the question. So it needs to be on the agenda, an issue on the agenda for them to change the policy. So just consider that when you're actually framing the research.
Actually, they're going into changing the policy. There have been reports coming out in the news that they're trying to change the policy. So I think the time is very critical now. If we can actually dig deeper right now, and maybe if we can eventually end up formulating policy briefs, I think the time is ripe right now. If we can take that into consideration. Any other questions? Thank you, everyone, for being here.